Good evening, everyone. Let me welcome all my viewers once again today on Beyond Sugar. We connect with you on a daily basis and post information for you, which is important for you to know to keep your health in a good form and also to make you aware about diabetes and its related complications. But not only we post information for you, we also invite for you leading doctors from across the country who can talk to you as a friend and who can answer the questions which you have in mind. Today, I am very glad to welcome Dr. Meena Shetty from the city of Hubli. Ma'am, welcome to the show.
Thank you.
From our viewers and followers of Beyond Sugar, we have been getting various questions on a daily basis, and we pick up your questions from that and curate the topics of discussion as well. One of the topics we keep on getting queries from you is around pre-diabetes. So all of us have heard about diabetes, and we talk about that, but there's also a situation called pre-diabetes, and we get questions from you, and mostly around that, if someone is in a pre-diabetes stage, then what should be done to prevent and safeguard the situation for you. But before I start taking your questions, let me formally introduce Dr. Shetty to all of you. She is a leading light and a very renowned doctor in the city of Hubli. Hubli is in North Karnataka. It's a famous city. Dr. Meena Shetty has done her initial studies, the graduation and the masters from Karnataka Institute of Medical Sciences, KIMS Hubli, a prestigious institute at the national level. And for last 25 years, she is serving her patients in the city and providing her services. And we know that we are talking today to an expert who can answer and handle all the queries, and we can trust each word from her. So, ma'am, before taking the questions, let me invite you and hand over the stage to you
Yeah.
to set the context around this topic, and then we'll move on.
Yeah. Many thanks, Sanjeev, for this kind introduction. We shall go ahead and look at a term called pre-diabetes. All of us have heard repeatedly about diabetes, but pre-diabetes, I would say, is something a transition from normal blood sugars more towards blood sugars, which can become overt diabetes. So we are looking at a place which is neither normal nor abnormal. This, I say, is a universe given gift to a person so that they can prevent diabetes. So, pre is the common term. Pre diabetes can be prevented from becoming over diabetes. So, this is what we are going to speak today on. And it's just a number game if you have to define pre diabetes. So we will look at those people who fall into the group where the normal blood sugars being 140 and abnormal blood sugars being 200 called diabetes. So anybody who is between 140 to 199 milligrams per deciliter are termed as pre-diabetic when it comes to a random blood sugar or a postprandial or after food blood sugar. If it is done in fasting, then a blood sugar between 100 and 125 is taken as pre-diabetes range. These days, the fancy number for HbA1c would be like anything from 5.7 to 6.4%. So that's what we medically call pre-diabetes. But let's go ahead and look at what actually pre-diabetes means to a patient or to the public in general. So
Okay. Yeah, thank you so very much for setting up the context and beautifully also sharing, with the viewers that what are those numbers, because people know generally, what is the numbers they should be aiming for if they have diabetes, what's looking like a good control. But you explained an HbA1c of 5.7 to 6.4 can be termed as pre-diabetes, and also the fasting blood sugars of less than 125 but more than 100 as well. Now, this is certainly different from diabetes. So, now please help us, ma'am, understand the viewers that what are the common risk factors in such a or difficulties which a person may face in this phase when he is pre-diabetes, and also please help us understand that what are the most commonest risk factors for someone to actually come into this situation.
yeah, See, most often than not, all of us are, as Indians, at a threat of pre-diabetes and diabetes. So the first context I would say is like, by virtue of being an Indian, we are already prone to it because the number of risk factors which we carry because of our genetic factors, we are prone. A person who is obese, that is increase in their weight, more fat around the belly, that's a belly fat, with a waistline of more than 90 for a male and more than 80 centimeters for a female. uh, those who are at increased stress in their life, stress is a part and parcel of us, but that stress which cannot be normally handled by the person, those who have got family history of diabetes, more than 40 years of age, with other chronic illnesses like hypertension or thyroid issues, those who have had diabetes during pregnancy, young girls who are facing menstrual irregularities and termed as polycystic ovarian syndrome, also those people who are having vague symptoms with all these with a stage set like this, people do come with vague symptoms like inability to concentrate, a lack of vigor in their life, symptoms of easy fatigability. um, these are the people who are actually falling into this purview, and they need to be screened and tested for their blood sugars. And yes, the next question was, how exactly is this pre-diabetes going to affect the health of the person? Look, let me be at the onset very clear. Pre-diabetes is heralding diabetes. Okay, so we all know that anything which heralds diabetes is something already the stage set in for further complications. But there's one complication which you need to be taking care of, and that's called the ischemic heart disease or the cardiac related issues. These issues, which are related to blocks in the blood supply to the heart, that is the coronary artery blocks, tend to develop pretty early, much before diabetes, and it's well set even in the stage of pre-diabetes. So a pre-diabetic is already exposed to increased risk of cardiac problems, it is heart problems, mainly heart attacks, as we call in a layman's term. So there is a risk here. It's a serious condition. Let's be quite clear about it. So we have to take certain steps and we have to take hold of our life and be more disciplined to go ahead and tackle this pre-diabetes in our day-to-day life. So
Okay.
any
So
other
as
complications, as you said, we will go ahead in the talk and look at them. But at this onset, I would like to give a clear message that complications related to blocks in the arteries, as we call them, atherosclerotic plaques, are already there much ahead of time before even we pronounce diabetes.
Okay. So I think the message is loud and clear from the expert. Dr. Shetty says that it's not an absolutely safe situation to be, even if you are not in a full-blown diabetes, but in pre-diabetes. So there can be a risk of complications, and therefore this situation should not be ignored and actively pursued to get corrective measures with the corrective measures. Ma'am, can you help us also viewers understand, since this is not a full blown diabetes but a situation, let's say -1 of that, then can this be reversed to to get into a normal situation, or at least if not reversed, then can people somehow prevent this from progressing to a full blown diabetes situation? Is it a reality? Can this be achieved?
Yes, the good news is that pre-diabetes is reversible, and you could definitely put brakes on it and actually stop it from becoming a full-blown diabetes. It's doable, and very well known that if something is doable, then it needs to be done because this is concerning our life, the very life which we are living. So yes, it's doable.
Okay. I think again the message is clear that if you are having a pre-diabetes situation, then this can be reversed also, and definitely it can be stopped from progressing to a full-blown diabetes. And we will try and learn from Dr. Meena Shetty that how this can be achieved. Help us understand, ma'am, from first of all from a individual's point of view. We'll come on to the doctor's approach and medications later on, but let's say if someone knows that his blood sugars are currently falling into pre-diabetes, then what should he be doing? Are there any lifestyle changes which he can do or she can do, or are there any diet modifications which someone can do? Please help us understand that.
Yeah. It's actually a pleasure to talk about this because I'm not going to write prescriptions here. So, we're going to talk about non pharmacological methods to control the blood sugars when you are pre diabetic and also to reverse it. First and foremost, the goal would be to the get your body weight down, to reduce your body weight. So the goal of the whole non-pharmacological intervention would be to reduce the body weight by 5 to 7%, and if possible at 10%, because it's shown time and again that getting your body weight down by around 7% can reverse the pre-diabetes to normal blood sugars. So, if you are, say, weighing around 70 kgs, you have to reduce your body weight by 4 to 7 kgs to actually get your blood sugars back to normal. So, how are you going to go and do this? So, let me tell you that if I was a pre-diabetic, that's what Sanjeev asked me from a perspective of a patient. So, if I am a pre-diabetic, how will I go ahead and do this? There would be it can be discussed under few headings, like we're going to look at lifestyle modification. Lifestyle modification actually includes our day-to-day routine. We need to become a disciplined person. If you want to prevent one D, you have to inculcate another D inside your life. That is, if you want to keep diabetes at bay, you will have to become more disciplined. That's very clear. So, what would be this discipline? If you're looking at, let me say, I will start, everybody starts from morning, right? I shall start from the night. So, I shall look at sleep, exercise, the nutrition or the diet, and the last but not the least, certain behavioral tools which can help us tackle pre-diabetes. So I would say, as an individual, sleep is one thing which is a wonderful drug, which is God-given drug to us, so that if you can sleep for 6 to 8 hours peacefully and rest the body, it will address so many things. I can be able to handle the next day better. The stress levels are going to come down if I'm rested. If I'm sleep deprived, I will be depressed, and also my work efficiency will come down. Along with that, what happens is the stress itself of lack of sleep will produce certain stress hormones in the body. Stress hormones, as we call them, as cortisol, adrenaline, noradrenaline, and a whole of others in a doctor's dictionary. All these stress hormones are going to prevent the action of insulin. Insulin is a primary hormone which is going to digest our blood sugar. So the glucose which we take in is digested by insulin. Any dearth of insulin, any shortfall of insulin in the body, any time when insulin is not able to act, that is called insulin resistance in the body. There's plenty of insulin, that is, but there's a poverty of action. So there's plenty, but still poverty. A lot of insulin, but insulin is not acting on the body. So this is called insulin resistance. So whenever there are a lot of stress hormones in the body, there is a development of insulin resistance, and hence a person will actually fall from being be not having the ability to maintain normal blood sugars and will start falling into pre-diabetes. So lack of restful, peaceful sleep for 6 to 8 hours is an important factor which is going to precipitate pre-diabetes and going to give a solid invitation to diabetes. Why I'm speaking about sleep is there can be people who are not motivated to exercise, but there will not be a person who is not motivated to go to sleep. Yes, we will find people who are not able to sleep, surely, because of their own wirings and rewirings of their um, brain, but people want to sleep. So, next, I would say that how will I see that I get to sleep easily? I will probably put a designated time for going to bed, try and maintain the same time. Don't sleep with a full stomach. I will eat my supper or dinner at least 2 to 3 hours before going to bed. Try and sleep without the mobile screen because white light and screen really hampers sleep. Try and read a book which is not very interesting. Go take a bath, warm bath, and have a cool bedroom. Go to so you can fall asleep. Try and avoid stimulants like tea, coffee, alcohol, smoking, tobacco before going to bed. So definitely, all this is going to help us to fall asleep. And believe me, in sleep, the brain is rested, the body is repaired, and also your brain is fresh to actually and motivated to start the day. So, the next step would be after sleep, I would say the next step would be an early morning regimen. Be motivated to act on pre-diabetes. And action is in I would say not small words or in big words, action is in acting. So, what are you supposed to do is have a strict regimen where you can have fixed hours or minutes of exercise. So, the exercise could be, say, for 30 to 40 minutes for 4 to 5 days in a week, or even 7 days a week. 5 days is a minimum, and 7 days is wonderful. A regimen wherein you can have some good aerobic exercise. When we mean aerobic exercise, this exercise is going to use the blood sugar in the body and also mobilize fat because we're going to keep it for 30 to 40 minutes. It will be either in form of walking, jogging, cycling, swimming, dancing, aerobic exercise, anything which you love to do and which you can continue to do day after day, minute after minute, without actually somebody forcing you to do it. So what will you do? How, I mean, there are often people keep thinking, how fast should I walk to lose this body fat? It's very, very simple. If you're walking with a partner, you should not be able to talk and hold a complete conversation with the partner. You can answer in yes or no, maybe, may not. We'll see tomorrow, might be. But if you can complete a full sentence and continue to engage the partner in conversation, your speed is not good enough. So you walk at a speed and you cannot talk to the partner in full sentences and continue to do it. And that's when the muscle fibers will start using glucose and then mobilize fat. And after that, you will be able to lose weight if you continue. And next would be I would look at some training called strength training. Strength training is something wherein you use weights, or you can use bands, or you have got certain means by wherein your own body weight can act as weights on the muscles. And these are muscle strengthening exercises or muscle building exercises. And these muscle building exercises will help us to get muscles. And these muscles can then be used in aerobic exercises to burn glucose and fat. So actually, we will be bringing down the blood sugar to normalcy without the help of insulin and also breaking insulin resistance by this. And also you'll have to do some core muscle training like this abdominal muscles, back muscles, hip muscles, which need to be in shape so that they continue to remain good and help in exercise. So this is much sought after exercise. And of late, the gym has gone into off repute because of so many mishaps in the gym. All this is because of unstructured and unsolicited exercise. So, if you go slow and if you continue and if you are persistently increasing your strength as well as your aerobic exercises, there's not going to be much problem. You need to have a basic certificate from your doctor before actually we need to go and do all these exercises too. That's also to be mentioned. And next, as you said, Sanjeev, that if somebody needs to lose weight, they just can't exercise and eat all that is there in their fridge or in somebody else's fridge also. So the next heading after sleep and exercise will be looking at food. Food is such a lovely thing. Food is God and food is medicine. But food is most abused because we always think that our stomach is the fridge. So we try to take in as much as possible, put it in our tummy to be used for later date as fat in the body. So, yes, food is medicine and it has to be actually taken in a quantity which is regulated. Whatever calories we take, we should be able to spend. The calories which we take, if are they are not spent, then they become excessive calories stored as fat. And the fat which is there in the body around the organs, like in the liver, oh, you must be seeing that most of them get a fatty liver report. So food which is excess becomes fat, and fat in the liver, fat around the heart, fat around the kidneys, fat around pancreas. So everywhere there is fat, and this fat which is inside around the organs is going to actually again stimulate insulin resistance. So we need to regulate our diet, eat as much as we can spend, or then also try and spend from the fixed deposit of fat in the body. Food has to be, you know, most of it has to be in, as half of the plate has to be about leafy vegetables and non-starchy vegetables, that is, and the rest one fourth would have proteins. Proteins are the building blocks and they need to be there for everybody, and the rest of it will be in terms of complex carbohydrates. So let me explain to the as how it is. One part of it will be unpolished rice or brown rice, millets. You can even include wheat, jawar, ragi in that. The rest of it will be vegetables, which we get every day to day, all fresh vegetables, mainly green leafy vegetables. And proteins for us Indians would be either vegetarian or non-vegetarian. Vegetarian protein would be cereals, pulses, nuts, seeds, sprouts. We are looking at paneer, milk, and milk products. And carbohydrates would be, as I said, brown rice, chapatis, jawar also do come under carbohydrates. But for the non-vegetarian, it will be chicken, fish, tofu, and all that is vegetable available for the non-vegetarian platter, except the red meats. The red meats are a little uh, uh, um, uh, things which you need to handle with care and not actually overindulge. So next comes, we have already divided protein, we have had carbohydrates, we have vegetables and fresh fruits. Fruits are to be taken. That which needs to be avoided are white flour, that is maida, and white rice, and then anything which is made from refined flours, fast foods which are used in the packets, lot of fries, lot of deep fried oils, and trans fatty acids, they need to be avoided. So the food has to be something which is fresh and something which is available locally. Excessive oil and excessive deep fries, too much of fat in the non-veg portion of muscle, and liver which is being directly fried and eaten, all has to be avoided so that the blood sugars as well as the cholesterols remain at bay. So this is about food. I leave
Sure.
certain things about food because I know there'll be so many having specific questions. So we will go and look at other things as the need be, as you feel essential for
Sure.
the viewers.
Sure. I think for my viewers, I can say that any of the things which Dr. Shetty said in last 10 minutes, you forget. Just rewind this program and listen it again and again. The way so beautifully she has explained that what lifestyle measures should be taken and how they should be taken. I think she talked about the body weight to begin with. Reduce your body weight between 7 to 10%. Very, very important. And how you can do that, she's explained that as well. Sleep, I think she emphasized enough on sleep, how important it is. 6 to 8 hours. She told some techniques. Don't use, keep your TV on in the night while sleeping. Don't use your mobile phone, and maybe have a nice sleep for 6 to 8 hours. And she talked about exercise, like that, and then what kind of exercises can be helpful to individuals to to really make get some good impact of it. So I recommend that you generally we don't get so much of time from our doctors while we visit them, and whatever she has said is so much precious that you must memorize this and try to follow. uh, you rightly mentioned about diet, ma'am, and diet modifications. It's a subject in itself, and we can probably spend an hour talking about diet only. But we have noted down some of the important things which you mentioned. I specifically want to hear from you, ma'am, for our viewers. There are three things which are much talked about, that, and there's confusion as well, that what kind of oil should be used, and by someone, uh, and in how much quantity it should be used. Second thing about sugar intake, that while you are in pre-diabetes, are there any limits on sugar intake, or what kind of sugary things can be taken? And third one is on salt as well, that what role does it has, and what's the ideal usage of salt in our kitchen. So if you can, just highlight about these three things, I'm sure people would like to hear it from you.
Yeah. Salt is easy to handle because it's just a pinch of salt. If you can put your three fingers together, whatever comes in it is that salt which you're supposed to have every day. Or if you want to put it in a very refined way, a flat teaspoon of flattened teaspoon, a small teaspoon, is what one needs for the whole day. That is the amount of salt. If you are asking me about sugar, I'll say, what is that? What is that sugar? I don't know about it. And that's how a pre-diabetic is supposed to be. They're not even supposed to hear sugar. So forget eating it. So sugar, refined sugar, and most often even jaggery are a no, because actually when sweet was introduced in the food, Sanjeev, what I would like to say is people did not mean eating sweet. They meant being sweet. You know, you have to be a sweet person, not eat sweet. So if you want to be a sweet person for a long time with a healthy life span, then you are supposed to avoid all direct sugars. A big no to refined sugars and jaggery also, including sugarcane juice, because that's something which comes up and says, we just had a glass of sugarcane juice. No canned juices, no juices which are fresh juices which are available, because they all have added sugars. Most of them do have added sugars. And a word of caution to my all viewers: please do not have fruit juices. I would ask you to eat fruits directly as a whole fruit, because if you're supposed to have a fruit juice, God, I'm sure, would hang a fruity from a mango tree. Why should you have a mango? So eat the fruit, because the fruit comes with added virtue of fiber, and fiber in the diet is extremely important for a pre-diabetic or for a diabetic for that matter, because this is the only ingredient in the meal which can allow you to eat some amount of carbohydrate without the guilt, because fiber is going to allow the carbohydrate which is ingested by you, eaten by you, to be released slowly. So the carbohydrates in the food is released slowly because of the presence of fiber, and that slow release of sugars into the bloodstream can be very well handled by even minimal insulin. Even a little bit of insulin can handle these slow rising sugars. It is the spike of sugar which we cannot handle as pre-diabetic. So slow rising sugars can be handled. So you can have fruits, but very, very sweet fruits, I wish you could avoid, especially the sapota and the grapes, and much of those fruits which are available seasonally can still be had. And regarding refined sugars, no. Regarding complex sugars, you can have complex sugars, meaning say brown rice, millets, everything, wheat, jawar, ragi, everything has got sugar in it, and that can be handled because of the innate presence of fiber in it. So the fiber rich food is good, even if it's a carbohydrate. The third one was oil. Wow, oil market is a big market, and so everybody wants to promote oil which is grown by them. So that's indeed how many oils which we don't have, you don't produce in India, have come to India, like olive oil has really gained a lot of market, because that's studied by certain countries and put as the best oil. But to me, the oils which were used by Indians for their local cooking are still good. Like I would think I would use a safflower oil or a groundnut oil or a vegetable oil, all that oils which were present with us for the last decade, I mean, last 10 decades are good oils. But the good thing about these oils right now is they're available as cold pressed oils. And I advocate the use of cold pressed oils because there are certain saturated parts and trans fats which are not available in cold pressed oils. So go for cold pressed oils. Use the oils which you use regularly by your grandfathers and great grandfathers, because the diet which we have along with the oil matters. Like a coastal side, we use Indians use coconut oil, and what's the distribute? It's got saturated fats. But don't forget that the coastal person also eats fish. So that's a combination you're looking at, not just the oil per se. Nobody's going to drink a glass of oil, believe me. And third thing is that the oil which you use for deep fries should never be reused for anything. That oil which you use for frying, deep fries, has to be discarded, because that oil is almost poisonous and that oil is going to cause the blocks in the arteries. So my earnest request is use cold pressed oils. They are costly, so you'll use them in limited quantity. Good. And when you fry, don't reuse that oil. If you do that, believe me, you will use less, you will do, I mean, prepare less of deep fries because you'll be wasting a lot of oil. So eat as much as necessary. But let me finish this by telling fats, oils are essential part of diet. Do not mark them as no. They are an S, because a small amount of oil in your diet will help you keep your intestines healthy. They are also going to keep your food palatable. They're going to slow the absorption of the food, and so again there'll be slow release of food, and that will help the blood sugars to be maintained. And this fat in the food, oil in the food, is going to keep you filled up, feeling good and full stomach for a longer time. So you will not keep on eating food again and again, again and again. So it will help you to remain full and not feel repeatedly hungry. So oil is necessary, fat is necessary, cholesterol is necessary for the repair of your nerves and the nerve cells, which we call, for the repair of your cell and cell membranes, which are very important for your memory and good functioning of your brain. So these are all essential ingredients. But anything which is good, when it is really overindulged in, it becomes bad. So they're just the sides of the same coin, two sides of the same coin. So that's my loud and clear uh, message to everybody who listens to this.
Great. Thank you for explaining that again in full detail. Also, ma'am, the viewers would like to understand that if someone is detected, let's say in a situation, he normally people go and do blood sugar themselves also these days, and they find themselves in this range which you earlier mentioned, 100 to 125 fasting, or an HbA1c of let's say 6. What should be done? Should they go to doctor, meet and take consultation immediately, because this is not a diabetes state, so many people may ignore. So what's the recommendation? And
Yeah.
secondly, once they reach the doctor, are there do you generally in your treatment approach, do you put such patients on medicines or any supplements you provide them?
Yeah, once if you are getting those ranges of those numbers of pre-diabetes, I would suggest that you take some expert advice, because the doctor would probably go ahead and look at your triglycerides, look at uric acid, look at your liver enzymes, find out if you have a fatty liver, and see if your cholesterols, triglycerides, bad cholesterols are in range. How are they? Can they be handled non pharmacologically, or should you be again advised certain other pharmacological modifications? Yes, they need to at least take a consultation, and also keep their sugars, recheck their sugars. Probably earlier the whole thing was to check them once in a year, but I'm not sure about those guidelines anymore, because practically we need to check their blood sugars more often, especially if they are very stressed and they are going, if it's going from pre-diabetes to diabetes. So I would rather put them on 6 monthly checkup, or as need be tailor made for that particular person. And so you need to go to an expert. Would we put them on any supplements? If they're found to have deficiencies like either vitamin D deficiency, which has become very common, and then, or if they are having very high blood sugar, cholesterol levels, we need to really tame them with certain drugs. And if they are having zinc deficiency, B12 deficiencies, anything which needs to keep the body healthy so that it can handle pre-diabetes with non-pharmacological measures, that support I'm sure we need to give to the body. So if you're going by
Sure.
non-pharmacological means of lowering blood sugar, then anything and everything else needs to be handled there. So yes.
Okay. Yeah. So if you fall under, these ranges and the pre-diabetes kind of a situation, then do take a medical advice from your doctor. Earlier you take this advice and start following the advice, better it is, and you can prevent yourself from moving to, the complications or a full-blown diabetes. What about, you mentioned, ma'am, that you call such patients or, such people who have pre-diabetes once in 6 months. So now, is there any, regimen which you suggest to people for screening also? Generally, if someone gets diabetes, they will do it maybe, daily. They'll do one or two tests, or weekly. What's the dictum or what's the guidance for people who are in pre-diabetes? How often they should screen themselves?
One, see, if they are determined and disciplined, they can definitely screen themselves once in 6 months, 1 year. Doesn't matter, because these are disciplined and determined patients. They are ready to do the what is said to be done. So yes, once in 6 months is fine. If they're not very sure about it, then they need to cross check themselves repeatedly once in 3 months. If they are denying pre-diabetes, then they need to go on a continuous glucose monitor. Therein you have to put a patch on them and monitor them for the 14 days to show what their food does to the blood sugars, what exercise does to blood sugar, what sleep does to blood sugar, because you're going to get continuous glucose monitoring. Every 15 minutes there will be a blood sugar available, and then you can have what to say is an informed person, patient who is ready to, who is motivated to do the lifestyle modifications which are required of him or her to get the blood sugars and the body weight down. So this there's no fixed regimen, because I'm not an institute, or I'm not a association. I put my patients as those who need to be handled with a certain sort of motivations. So it is just a motivation which is making going to change the whole scenario from pre-diabetes to normal blood sugars.
All right. So it all depends on your medical condition as well your motivation and behaviors. Basis that your doctor will decide. What about, ma'am? You mentioned that this is, one time, one period that one needs to be disciplined. He needs to be motivated. Sugar, he just needs to be sweet, but don't eat sweet. A lot of, discipline has to be followed probably. But then, there are so many social situations, which may arrive. People may say, if you go to a function, your friends, that okay, you don't have anything, so it's okay. So there are so many social pressures, especially in our country, which is social
Very
life
sweet
is very
country.
active of people, and people love eating. So how do you advise such people that what how they should be managing themselves and pick up right healthy choices for themselves?
Yeah. You know what? If there is somebody who can write something, they would have first written how to say no in a nice way. You know, you have to learn to say no in a very nice way to, to the blood sugar, to the sugary items which are presented to you. One. So there's art of saying no. One. And two, a time will come when 80% of us will have higher blood sugars. So there'll be nobody forcing the other person. So we just have to wait for that. Already the time has come when you're serving tea or coffee, either you have two thermos, one with sugar, one without sugar, or everything is without sugar and need be add sugar. So already those days have come. And I'm sure even God will say no to sugar when it is given as prasada, when it's given as a offering to God. So that time will come. Other than that, it's just self discipline. So if I have decided that I shouldn't eat such and such a thing, It's just that how strong is my willpower, is, which is going to decide how somebody is going to force me to eat. Yes, you have gone to a wedding and people will say, please have the sweet, we have made it for you. Just carry a polythene bag, or no, sorry, you have to carry a friendly, environment friendly bag, carry a tiffin box, steel tiffin box, and get it home for those people who are non diabetic. But you will have to learn to say no. These are the behavioral changes which you need to make. As I said, the fourth heading was behavioral changes which we need to make as non diabetics, as diabetics, as pre diabetics. We'll have to draw a line as to actually offering and forcing. I can offer you or I can force you. So we need to learn that art of offering and forcing, and also need the master the art of saying no, and also keep all our negative emotions like anger, stress, jealousy, pride, ego under bay, and let us have a more kind and prayerful, compassionate, sympath I mean a lot of empathy in life, because those two virtues and vices which I'm speaking of are, actually, those kindness, compassion, and loving forgiveness are going to increase our action of insulin and reduce the insulin resistance. And the rest of them, the ego, the pride, and the anger, and the jealousy, and the revenging things, are going to actually increase the hormones which are going to be stress hormones, which are going to increase insulin resistance, and also invite diabetes, and and also invite obesity. The fun is, all these bad emotions are going to invite obesity also. So these are behavioral changes which we need to make, and social gatherings will slowly learn it, because if we are five in a family and four of them are diabetic, who is going to force whom? Please tell me that.
Yeah. So remaining disciplined is important, whether you have the art or no, or not. But learn to say no at least, and don't get carried away, because that's the only way you can safeguard yourself from moving into a full-blown diabetes situation. Very, very important point again highlighted. Since, ma'am, we are running out of time, I'll just take one question from you, and that's about, are there any emerging science, or newer things which are being innovated currently to manage a pre-diabetes situation where someone is, given a medicine or something or some advice, and he doesn't move towards diabetes? Anything, which is emerging, which you want to tell us?
See, the long-standing drug metformin is still helpful for a pre-diabetic, and it is used, and it is found to help many medical conditions which are associated with pre-diabetes and diabetes. And there are certain drugs which have come in the market which are helpful to reduce body weight, and so anything which is going to reduce body weight can also address pre-diabetes and reduce the risk of complications of diabetes. But still, there's a beautiful, wonderful drug which is in the pipeline, and that's the non-pharmacological interventions of sleep, exercise, diet, and kindness.
Yeah. So
So be kind to
although these are non-pharmacological things, which are non-medicinal, the things which she said, sleep, your exercise, but these are well researched in the medical science, that these are the things which may help you prevent moving to a full scale diabetes. I think, ma'am, you have been very, very kind today in taking all these questions, which were, some of them were very, very basic, but I still wanted to ask you for the benefit of our large viewers. For them this will be useful. I must thank you, for being very, very candid, and I must thank all my viewers as well, who listened us today live, or who may be listening this program later on. If you have anyone in your friend circle, or in the family, who has these risk factors which Dr. Shetty mentioned, you can simply share the link of this program with them. This conversation can be very helpful and useful for them as well. So share that. But before I conclude, ma'am, this program, I once again give it back to you for your final remarks. Anything you want to say in summary to us, to our viewers, or anything which is important and which got missed in this conversation, and you still want to highlight.
Yeah, nothing was missed except that I would again say be a sweet person and don't eat sweets. So thanks for this sweet opportunity to put my views. The views which I have put in, some of them are very much mine, not according to the guidelines. And if there is something which somebody doesn't agree to it, then I take it upon myself as my personal remark. Yeah.
Thank you. Thank you so very much, Dr. Meena Shetty, for joining us today and enlightening our viewers. I'm sure that this discussion will be very useful for many viewers who may like to listen it or share it as well. Thank you so very much. We'll invite you again for another topic. And good night to you, and good night all our viewers.
Thank you.
Thank you, and bye bye.